National Eye Exam Month. Eye exams cover a wide variety of health checks. Some may surprise you. Eye exams are part of overall health. Deteriorating vision can be an early indicator of other health issues. Getting vision exams on a regular schedule helps doctors identify issues in their early stages. Your eyes are windows to the live action of blood vessels, nerves, and connective tissues throughout your body. Problems spotted in the eye are often the first signs of diseases lurking elsewhere. Here are some surprising conditions your eye doctor may detect during a comprehensive eye exam. Aneurysm. An aneurysm is a bubble in the wall of a blood vessel. This weak wall can leak or rupture. Sign of an aneurysm can include a severe one-sided headache or loss of facial or body function. Aneurysms can be catastrophic and require immediate medical attention. Brain tumor. Tumors can cause increased pressure in the brain that gets transmitted to the eye. Swelling near the back of the eyes causes changes in the optic nerve that an eye doctor can see. Loss of side vision, recent double vision, or changes in the size of a pupil are other signs of a brain tumor. Cancers of blood, tissue, or skin. Numerous cancers can be found during a detailed eye exam. Skin cancers affect the eyelids and outer surfaces of the eye. The most common type of skin cancers are basal cell, squamous cell, and melanoma. Leukemia and lymphoma can also affect the interior aspects of the eye. Tumors in the breast and other areas can spread to the ocular structures. Diabetes. Tiny blood vessels in the retina that leak yellow fluid or blood can be a sign of diabetic retinopathy. Sometimes this disease appears in eye tissue even before a person has been diagnosed with diabetes. Early detection can help avoid vision loss and other serious complications. Giant cell arteritis. Giant cell arteritis, GCA, is a lingering inflammation of medium-sized arteries that affects the arms, upper body, and neck. These same arteries help nourish the eyes, and inflammation can result in blurred vision, double vision, or even sudden vision loss in one or both eyes. A dilated eye exam and blood tests for this condition can allow for early diagnosis of GCA. Medical treatment can prevent a lifetime of blindness or even death. High blood pressure. Unusual bends, kinks, or bleeding from the blood vessels in the back of the eye can signal high blood pressure, which affects 1 in 3 American adults. High blood pressure is a known risk factor in the onset or progression of glaucoma, diabetic retinopathy, macular degeneration, and other diseases. Your doctor may notice signs of high blood pressure during a dilated eye exam. High cholesterol. A yellow or blue ring around the cornea may be a sign of high cholesterol, especially in a person younger than age 40. Deposits in the blood vessels of the retina can also indicate elevated cholesterol. This may be a precursor to a life-threatening stroke. Lupus. This inflammatory disease can coincide with dry eyes. Lupus can also cause swelling in the white part of the eye, the middle layer of the eye, or the light-sensitive tissue in the back of the eye. Lyme disease. Lyme disease is an infection spread by ticks which leads to inflammation throughout the body. Many people with Lyme disease experience inflammation of the optic nerve as well as an increase in floaters in the eyes at the onset of infection. Medication toxicities. Several drugs may be toxic to the retina and the optic nerve. Symptoms of toxicity include red scaling eyelids, red eyes, scratchy corneas, or conjunctivitis. Multiple sclerosis. Inflammation of the optic nerve can be a harbinger of multiple sclerosis, a degenerative disease that affects the nervous system. Often this inflammation goes hand in hand with severely blurred vision, painful eye movement, or double vision. Sickle cell disease. People with sickle cell disease, a genetic blood disorder, develop stiff, comma-shaped red blood cells that can block the flow of blood throughout the body. This disease can cause a huge spectrum of ocular changes, from redness and burst blood vessels on the surface of the eye to severe hemorrhages and even retinal detachment inside the eye. Stroke. Blood vessels of the retina sometimes contain blockages or clots. These blockages can cause sudden blind spots or give the sense of a curtain closing over a person's vision. These can point to an increased risk of stroke. A loss of side vision may also be a warning of brain damage caused by a previous stroke.